Good day. Today we're going to perform closed continuous catheter irrigation. The purpose of this is to prevent blood clot accumulation that may occlude the catheter. Next, we need to review the client's record for us to determine the purpose of closed bladder irrigation. Also to recheck the physician's order, the solution that is going to be used, the type of catheter, and the frequency of flow of the solution. Next, we need to check for the color of the urine, check for any presence of mucus and sediments. Also, we need to check for the patency of the drainage tubings. And then also, we need to check for the tubings of the irrigation system. Check that there is no any kinks and it is clamped properly. And then also, we need to check for the remaining fluids in the existing solution. Next, we need to review the patient's medical record and check for the physician's order. And then also, we need to review for the intake and outtake record of the patient. For planning, we need to develop individualized method of care for the patient. Next, we need to gather all the equipments needed for this procedure. And then we need to also explain the procedure to the patient, what we are going to do, and the purpose of this procedure. Next, we need to confirm for the catheter irrigation in the patient's medical record, and then compute for the drip rate. And then also we need to gather all the materials and bring it along bedside for us to work comfortably. Next, we need to perform hand hygiene, and then put on PPE, and then identify the patient. Good afternoon, sir. I'm your nurse for today. My name is John Rose, and you are Mr. Teddy. And then we need to provide privacy by closing the doors and the curtains of the room. And then also we need to adjust the bed in a comfortable working position. Next, we need to empty the drainage bag of the patient, then measure the amount of urine, and then after that we need to expose the irrigation port and then place a waterproof pad below the patient. Next, we need to prepare a sterile irrigant bag, and then according to the manufacturer's directions, and then we need to label it as bladder irrigant, and then we need to include the time and date, and then place it on the bag, and then hang it on the pole 2.5 to 3 feet above the level of the bladder of the patients. Next, we need to cleanse the irrigation port using an alcohol swab. And then after cleansing the port, we need to connect the irrigation tubing to the port. Next, we need to check the drainage bag, and then check for the presence of the clamp and if it is open. Next, we need to check for the clamp if it is on, and then regulate for the flow of the irrigation tube or according to the ordered flow of the physician. Next, remove gloves, and then position the patient in a comfortable position, and then cover him with bed linens. Next, we need to assess for the patient's response to the procedure, and then also the amount and quality of the drainage. As the irrigation container needs to be empty, we need to discontinue the irrigation and then replace it with a new and full irrigation bag. Don't let the irrigation bag to be empty. Next, we need to calculate for the fluid that is used to irrigate the bladder, and then we need also to assess for the characteristics of the output. Next, we need to document for the type and amount of irrigant that is used, and then also we need to assess for the patient if there is any bleeding or increase in pain, and then report it to the physician. The next procedure is the close intermittent bladder irrigation. Next, we need to review for the patient's need of catheter irrigation in the patient's medical record, and then carry along bedside all the equipments needed, and then introduce ourselves to the patient, and then verify the patient's identity. You are Sir Mr. Teddy, and then wash hands, and then put on gloves, and then place the patient in a comfortable position, and place the bed in a comfortable working position. Next, we need to open the materials needed using a septic technique, and then aspirate the prescribed amount of irrigant that is going to be used. Next, we need to cleanse the access port using alcohol swab to disinfect it, and then fold or clamp the tubings below the access port. Next, we need to attach the syringe to the access port using a twisting motion, and then gently instill the solution to the catheter. Next, remove the syringe to the access port, and then open or remove the fold of the tubings, and let the solution or the fluids flow from the tubings to the drainage bag. Next, we're going to remove our gloves, and then secure the tubings by anchoring it on the inner thigh of the patient, and then place the patient in a comfortable position, and then drape him using a bed linen to give him or her privacy. Next, we need to secure the drainage bag below the level of the bladder of the patient, and then secure or ensure that the tubings has no kinks, and then we need to also assess for the patient's response to the procedure, and then dispose all the materials used in the appropriate receptacles, and then perform hand hygiene. Next, we need to calculate for the fluid that is used to irrigate the bladder, and then we need also to assess for the characteristics of the output. Next, we need to document for the type and amount of irrigant that is used, and then also we need to assess for the patient if there is any bleeding or increase in pain, and then report it to the physician. Next procedure that we are going to do is the removing of the indwelling catheter. Next, we need to review for the patient's medical record for the physician's order, and then we need to note for the time that the catheter was in place. For planning, we need to gather all the materials needed for us to work comfortably, and then we need also to provide privacy to the patient by closing the doors and the windows of the room, and then by draping the patient accordingly. Next, we need to position the height of the bed in a comfortable working position, and then stand on the right side of the patient if you are right-handed, and then stand on the left side if you are left-handed, and then wash hands, perform hand hygiene, and then put on gloves. Next, place the patient in supine position, and then place a waterproof pad between the patient's thigh, and then obtain specimen if required. Next, we need to remove the adhesive tape anchoring the catheter, and then remove any residue of the adhesive to the patient's skin. And then using the hub of the syringe, um, insert it on the port of the catheter, and then aspirate all the fluids that is being used to inflate the balloon inside. Next, gently pull out the catheter, and then cover the contaminated catheter using the waterproof pad, and then unhook the tubings from the bed, and then discard the used materials in the appropriate receptacles. Next, we need to measure and empty the contents of the drainage bag. Next, remove gloves and then perform hand hygiene and any other infection control protocols of the hospital. Next, observe for time and amount of the first voided specimen, and then note for any discomfort of the patient, and then record for the time that the catheter was removed.